I just want to welcome everybody. We're so happy you could join us today for our first community learning series, which is going to give you a sneak peek of what to expect as a kinesiology student here at UIC. My name is Jo Wagner. I'm one of the academic advisors for the kinesiology program. I'm joined today by Whitney Harris, who's the other advisor in our program, and Dr. John Coumbe-Lilley. Now, I am very excited to introduce this week's guest, Dr. John Coumbe-Lilley. He's a clinical associate professor for the Department of Kinesiology and Nutrition here at UIC. He's a student favorite and one of our most decorated faculty members. He's won so many awards, I could barely fit them all on the slide. We love his energy. He's a great advocate for our students and for the field of sport and exercise psychology. So without further ado, I will turn it over to Dr. John Coumbe-Lilley.
Okay, thank you very much, Jo. Can you hear me okay?
Yep, we can hear you just fine.
All right, beauty. So first off, I want to thank you and Whitney for organizing this in the department, for making this series come on. It's sort of embarrassing to see all of this on the slide. What I really want to let you know is my focus here at UIC is always on being with people. And so whether it's my students, research subjects, or the rugby team that you see I'm coaching now, I just really like what we do. I love being part of the field. I've been involved in kinesiology, physical education, sport from a very young age. And so it's just something I do on a day-to-day basis. It's like oxygen for me. You see at the bottom there, a picture of me in a rugby jersey. So I did play professional rugby and moved from there into the police, and then came here in '97 and started my life and career in the United States, in Chicago, Detroit, and then back to Chicago. So that's a little bit about me. I'm glad to be here to share these things. I do have a broad background, so I have an interdisciplinary background in business, education psychology, and sports psychology. I'm currently finishing another master's degree in counseling to become a licensed professional counselor next year. So I take a multi-disciplinary view to what I do and the way I do it. And that's very much informed the study that I'm going to share with you. And what we're going to progress on here is really focused on experiences that I had initially as a player, then a coach, then a psychologist, and as a researcher. So my origin story, which informs everything I'm going to share with you, is that in terms of sports, I came up from a young age in Dover, to the south coast of England, and I was never really encouraged to win or to go for gold. The way I was raised was always to give your best and just always to keep that as your standard. And so by always striving to do your best, that's a baseline that you can evaluate yourself against. So that's how I was raised. And so that sort of shapes how I see things a lot today as well. I prefer the standard of best versus gold, if you will. As my career progressed, semi-professional soccer and professional rugby in rugby union and rugby league, and of course, over a period of nearly 35 years of competitive play, I accumulated a lot of injuries, not least multiple ankle surgeries, which were the consequence of a career-ending injury playing for Scotland against Ireland. And so what was also difficult about that was it was my top-level debut for the senior men's team. And like many other athletes, I'd worked a long time to get there, and things changed from that moment. In addition to those injuries, multiple concussions, tears, sprains, dislocations, and just short of 50 stitches in my face as well for different wounds. So come to this with a history of injuries, lots of different coaching experiences, whether it be in soccer, track and field, or rugby, at the local level, regional, national level, and then clinically working with folks along those levels, including the Olympics as well, and working in sports medicine contexts to help athletes try to recover towards their performance, hopefully their return to the performance they had before. But the most important priority was help them get back on their feet emotionally and physically. And so 2017 was a kind of sort of catalyst for the work we're going to talk about here in three ways. I was invited after a period of 12 years working with national teams to work with a Division I college in our region here in the Midwest, and who had several athletes that were all recovering almost simultaneously from the same injury with the same surgeon and the same medical staff, which is very unique. And a colleague of mine reached out and said that they had heard I had this experience with athletes recovering from severe sports injury and being successful. Would I come and spend 6 to 8 months with their sports medicine team and the athletes to help them recover and get back on their feet? And so happy to do that. As I was going through that process with those three athletes, and it was in an organization that I didn't really know, I got to see firsthand some things that really made me curious, but also made me wonder just exactly what was going on in the rehabilitation process, because I saw things for the first time I hadn't seen ever before, which led me to refine my teaching a little bit and then really get into the research. And so when I say research, this is what I'm going to focus on. If you're not familiar with the psychological, sociological, and biological relationships of emotional recovery, which is what I focus on, and trauma recovery. On the left of the screen, you see here a very famous model called the Biopsychosocial, and it's a number of interactions that are happening. Now, one of the difficulties that this model presents is that it's deep, and it means that you have to really get to learn and know the individual athlete that you're working with. You can't take their life for granted, and one of the things you learn very quickly from doing this work clinically is you're absolutely not an expert in their life. You also learn that everybody's biology, on the face of it, might seem similar, but it's actually quite different. You learn that injuries heal differently, that there are genetic dispositions that sometimes are different than what people expected, that tissue heals differently, that biomechanical recovery doesn't always happen in a straightforward manner. You learn that the social aspects, and we're talking about collaboration, cooperation, community, conflict, and the relationships that you have with significant others, being coaches, teammates, doctors, athletic trainers, physical therapists, boyfriend, girlfriend, spouse, and so on, are absolutely vital. And you find out very quickly when you examine an individual's life in the context of this model exactly how the quality, type, and source of support and social relationships help or hinder emotional recovery. And now on the psychological side of things, we're thinking about cognition, so thoughts, feelings, emotions, and the interaction. And so there's a lot of complexity, and it's difficult sometimes to tease those things apart, which is why you have to take your time with individuals. And I'll come to that a little bit. And then on the right of the screen, you see what's called Bronfenbrenner's ecological theory. And so why this is really important is because when you're working with an individual, you put them in context in their situation. So there's the individual, there's their family, or their family is a microsystem. The mesosystem is the broader community, so that could be, their school, their workplace, it could be their medical team. And then there's the broader societal system, the exosystem and macro systems. For the purposes of this work that we're going to talk about today, we're focused on the individual and the individuals immediately around them that claim to be part of their mesosystem. Okay, so we've got the individual, the microsystem, people immediately around them, then the mesosystem, which are those community level organizations and agencies, if you will, that claim to be part of this. And I'll come back to this word claim because it's actually very important to understand what's meant when we're talking about claims. So when I started this work, it's now 2 years ago, and we have 42 cases to draw on. I'm going to share with you today. These were the questions that I was examining. This is a qualitative investigation. On average, I interview athletes for between 60 minutes and 2 hours. That's a big range. And our average right now is standing at about 65 minutes. And every athlete has experienced what we call severe sports injury. That is injury that has kept them out of their sport and performance for 6 months or longer. We also included dancers as well because of injury. And in our analysis, we're teasing that out. At the start of this research study, those experiences I'd had as a player, coach, sports psychology consultant, framed this because I really wanted to do something about what I'd experienced and the suffering that I'd seen firsthand from individuals. And you're going to hear me talk a little bit more about individuals instead of athletes, because one of the things I know as a person is that I prefer to be treated as a person rather than an athlete. And what I've learned through these 42 cases is that 42 people prefer to be treated as people first and athletes second. That's not to say that athletic identity isn't important, but within the scope of emotional recovery and let's say an individual's ability to live with themselves, they have to be okay with themselves as a person. And so these questions of how does emotional recovery following severe sports happen, how certain is emotional recovery, what are the contextual factors, what can we do about it, is really what that fourth question is getting to. And then how might emotional recovery be evaluated? And so these were the questions that were driving me along, if you will. And because it was an open investigation, qualitative in nature, we had an IRB-approved semi-structured interview that also had what's called an ecological validity check at the end of it. And what that means is that we conduct a second check where the individuals are able to rate their emotional intensity, positive or negative. We'll come to that a little bit. But the idea of that is then to make sure that the story that we've heard in the interview that's responded to the 8 standardized questions that we ask is actually valid. And then when we do an analysis following that, we check back, which is called external checking. We check back with the person that we've interviewed to make sure what we think we know is actually what they intended us to know. And so this is a basic process, standardized process for interviewing to make sure the story you've got is the story that the person intended to tell. And I use the word story intentionally because it's narrative. We're interested in people's stories. And this is actually a movement in qualitative research to understand individuals. What you've got here is the model that has started to emerge from our cases. Now, you might have heard of the stages of grief, Kubler-Ross, and so on. You might have heard of like a J-curve of change. One of the things that we're fairly clear now from our 42 cases is that stages of grief model doesn't have any validity whatsoever. And that was actually one of the things that had compelled me to do the research in the first place, was that I saw that and I witnessed the individuals were being treated as if they were dying. And if you're not familiar with that model, the entire model is based on one person's understanding of terminal terminal cancer patients' experiences towards death. And the model of death and dying, the 5 stages model, grief model as it's referred to, has been adopted into sport recovery without testing or evidence, unclear definitions, no measurement, and no clear clinical process. But over the last 50 years, it's taken hold. And one of the things that I saw clinically was that when you treat somebody as if they're dying, it doesn't leave a lot of scope for recovery. And so I thought there are other ways to help people rather than treat them as if they're dying. And so what we found, though, was initially this threshold model. And so as you look at it from left to right, the vertical axis is a self-referenced scale of emotional intensity from positive So it's 0 to 10, neutral to 10, positive emotional intensity as the athlete defines it. So it's self-referenced. And then minus 10. And so I've given you here two ways of looking at it. The very first injury, and then across the y-axis, it's the y-axis here, I always get this confused, is the months. So the numbers going horizontally are the months to recovery. What we find is that there's an unwanted threshold. And when we say a threshold, we're talking about a crossing. So an unwanted crossing from positive to negative because of the consequences of the injury, be it pain, feeling of hopelessness, loss, despair. And then for athlete 1, you see this hope threshold. So the hope threshold is defined by the time to cross over positively from negative to positive, hold the gains of physical, biological recovery with personal optimism and social supports, providing the necessary growth to recover. Okay? Now, growth has a whole different meaning in this situation because severe sports injury, for our study of 42 cases, only one of the cases resulted in the athlete returning to elite performance. So growth here is defined quite differently. When we're talking about growth and recovery, for the majority of athletes in our study, recovery is simply being able to move better than they could. So there's functional enhancement, functional growth, functional performance. What there isn't is a return to elite sport or return to the level they're at prior to the injury, okay, in the same way. We do have lower level athletes at high school that did return, but they returned in a way that they were not starters, they were replacement players. So just a note on the subjects, all the subjects are 18 to 46 years of age currently in our study, from team sports and individual sports, injuries to upper limb, lower limb, and also brain trauma. So going back to the hope threshold, so the hope threshold is what the athlete wants to happen, and it happens relatively quickly. When they move to the return threshold, it's because they're holding the gains and they can see that they're slowly coming along, and then this emotional recovery takes a long time to unfold, if you will, before they're really feeling good about things. Now, this is in the short frame. Athlete 2 has multiple thresholds. So athlete 2 is more than norm, frankly, for the people in our study. So they hit a low point, they return, they have a setback, so they have an unwanted threshold, they get a return threshold, which is longer than the hope threshold. So hope and return are now different. And then there's a frustration threshold, which they cross back whenever injury setback. And then they sink a little bit. And then the delayed threshold signals, in most cases, folks have been told they're going to recover between 6 and 9 months, and that doesn't happen. And so the delayed threshold is coping with the difference between your expected recovery and your delayed recovery. What we've seen are some characteristics of behavior and expressions in our folks. So we see the initial crossover feels like despair. We notice that people become more self-aware, that athlete 1 bounces back sooner. We know the differences based on our research between athlete 1 and athlete 2 are a multitude of factors related to the biopsychosocial model and the systems model by Bronfenbrenner. For example, we know that their youth, the time they've got left in their sports career, the access, financial cost, the convenience, the quality, and the timeliness and the relevance of the healthcare have significant positive consequences on the emotional intensity experienced by athlete 1. We also know that on the other side, that with athlete 2 compared to athlete 1, we know that there's often a discrepancy in the relationships. When they get injured, we notice that the relationships of athlete 2 are not as strong as they thought they were, that they're insufficient in both technical information, emotional support, informational support, that the cost of healthcare, the timeliness, the relevancy, the quality are all in question. So we've seen some very clear data indicating that from all of our subjects. We also have seen that depression is normal, and in some cases it swings from neutral mood to suicidal ideation. And so this graph, I'm going to show you an average picture in a second, but basically the variance between individuals is significant, and we see coping for athlete 2 in drugs, alcohol, risky sex, tobacco use, not showing up to class, not showing up to work, weight gain, weight loss. And what we see is that the degree of aloneness and the degree of worth influences depression, influences their identity in a way that fragments and not in good ways. And it takes time to recover from feeling diminished in oneself. So feeling less valued, less affiliation, less belonging, not seen as important. All of these things, there's an interaction between the self and the other that is going on that we've seen in our study. And so what you see here is the average of our study. And so over time, what you notice is the longer that it takes you to recover, the longer your negative emotional intensity is. We have found, by and large, that very few athletes recover emotionally within the time frame that the protocol for physical recovery states. We also recognize that irrespective of level, so we have pro athletes and community level athletes in this study that have similar experiences. There are college athletes and professional athletes that swing very low and experience tremendous emotional difficulties that in some cases, as I mentioned earlier, have led to suicidal ideation, requiring counseling and medication and so on. So what we have found, relative to our questions, is that we asked them, the second to last question in our interview, asked them what could have been, looking back, what could have been done differently to make your emotional recovery even better? And the responses range from better quality of medical care, more professionalism for medical teams, psychologists who know how to work with injured athletes that have severe injuries, coaches trained to be able to communicate effectively and reduce conflict, family member education, continual collaborative support, emotional support through the entire process of care until such time that the individual themselves feels like they can stand on their own 2 feet, if you will, emotionally. Coping strategies that are taught, because from the athlete's point of view, the onset of injury means that they're going to face a multitude of adversities, many of which they might not have faced before. And before they can grow, they can cope. And I want to come back to the idea of claims and growth. When we're thinking about claims, people make a lot of claims about athletes recovering or individuals recovering, and often they make claims about being part of the process. What we have learned is that people that suffer emotionally are very clear that the claims made by coaches, medical staff, psychologists, or teammates, when they're put to the test, under adversity, that is when they find out if those relationships are really sufficient. And so knowing what the claims are how can you say, testing the claims is actually part of the process here. The part about growth, so we've learned in Western culture, and this isn't, I don't think it's a surprise to anybody on this presentation, in Western culture, people are often pushed to get over things or get beyond it. And one of the things that we've learned through the study, as we've learned in other studies, is essentially we're dealing almost with a post-traumatic stress disorder. So that's defined by an eliciting event. So severe sports injury is an eliciting event. And so typically life after the injury is different consequentially than life before the injury. And what that means is that recovery just might be coping. Growth isn't the goal out of trauma. Sometimes getting through the day is the best outcome for an individual. So one of the things that we've learned here from looking at the literature on growth is that when people are pushed or feel pushed by culture through relationships or self-imposed pressure to grow from the experience, it often undermines the actual emotional recovery itself. And so it's a delicate balance between facing adversity that comes from severe sport injury or severe injury from dance, learning how to cope in the moment, and then setting ourselves up to face challenges that might help us grow. But growth in itself from trauma isn't mandated, it's not required. Just that there's an alleviation of pain and suffering so that the person can face life well enough to live it nicely. So that's, I think, an overview of the research. Big five that we know. Coming back stronger is uncertain. It's not true that athletes will come back better. What we know is that body, mind, spirit don't heal in the same time. Good news, the stronger the degree of hope, the more despair and tragedy can be undermined. And so we know that faith for some athletes plays a big role. We also know that optimism as a trait, characteristic, is also quite helpful in this situation. We also know that emotional health in rehab is often rhetoric. We take this position that it's rhetoric because we know from the cases that we've experienced, these 42 cases, based on this sample of 42, and we're talking about a handful of the 42 have actually experienced processes that were intentionally emotionally supportive and intentionally designed to help them cope emotionally. And then what the final takeaway is that there's massive opportunities in the training and education of medical professionals, athletes, coaches, and family members to be better at the delivery of healthcare, to provide stable, consistent, and emotionally supportive situations, and to recognize that there's an uneven recovery for a lot of folks. And so change has its own course, emotional recovery has its own course, and trying to force emotional recovery can be detrimental to the recovery itself. So kind of want to stay there and take any questions, and thank you very much for giving me your attention. I'm open to your questions.
Thank you, John. We've also, as you can see, have our contact information up on the screen. So if you want to, take a picture or screenshot of that, if you think of something later in the day, absolutely feel free to reach out to us. Now, as we wait for the student questions to come in, Dr. Coumbe-Lilley, I have a couple questions for you. Sure. What advice do you have for our new students coming into their program?
Wow, I got so many. So let's take the first one. So first off, very unique opportunity right now to join UIC, given the social situation. No matter what we're facing locally, is to take the best opportunities you can from your professors in your major or on campus, So see a pot of gold in front of you if you can. Be optimistic. Take the opportunities that come your way. Find the breaks and try to go with those as much as you can. Second thing is your relationships in the major are really, really important. So feel free always to contact your teaching folks. John and Whitney that are on the call here now, unbelievably fantastic with the students in advising and coaching and so on. So I recommend taking the opportunities that come your way, build relationships. The third thing is just because you're young doesn't mean you're not good enough, right? So don't let your age get in the way of being good. Right? If you're good enough, you're old enough. This is one of the ways to think about things. So when you approach your work, approach it as if you've got quality, you've got capability, and you've got something to say. So make your own mind up about things and say what's on your mind a little bit. Back up some of the claims you've got. I think the fourth thing is that our campus is obviously incredibly diverse. And what I mean by diversity ranges from like faith, color, race, ethnicity, intellectual capability, the locations where people come from. There's a massive range of people, interesting people from so many different walks of life, so many different backgrounds, and soak it up. It's one of the best places in America to soak up, the range of the experience in America. And I think the last thing there, Joe, to recommend to the students is, anytime there's a problem, don't sit back and let it get bigger. Go and seek a little bit of support. Go and ask for help. There are people here that want to make sure that you're as successful as you yourself want to be.
Some excellent advice. We're still waiting for questions to roll in, so I'll ask you one more.
Sure.
Whitney and I know you very well. You've been teaching online for years. This fall, there's a lot of questions in the air with everything going on in the world, but can you tell our students who don't know you, how have you prepared to teach classes online or in a hybrid format this fall?
Yeah, so I'm laughing because it's ever changing. So for me, I've been teaching online, about 8 years properly. Yeah. So the way I prepare is to first start off with knowing the quality of the experience that I want the students to have. So that means the quality of the organization, the way the course is designed. So it's easy to access, it's convenient, things are stored where they're easy to find and follow. The learning is self-paced, is personal. For me, there's always interaction. So it means that I'm always prepared to talk, to email, and as we're doing now virtually, no problem. There are discussion boards. It's important that the engagement is high, so we're always prepared to engage around the content. It's actually really cool sometimes to be online learning because you're able to slow down and say things in a way that you might not in the same way when you're face to face. Sometimes I find folks are even smarter when they're writing. And that's because they've taken a bit of time, they've thought through what they're going to say, and then they put down some incredible thinking. And for example, last week, Joe, there's a couple of things that happened. There was a couple of students in my exercise psychology class that literally asked questions I hadn't seen in 10 years. I'd never seen. And so it was really exciting because the way that they crafted their response was so thoughtful, well evidenced, and I was like, bang on, we can do something new with that. So I'm prepared with the organizational design, the level of engagement, and always, Joe, what we're always going for, I think, at UIC, is to make sure that our students are stronger intellectually at the end. They're able to engage with their colleagues in the course so they've got some relationships. And the last thing is when they leave, they're confident they've learned something valuable and they take it forward and they become even stronger in their learning or in their life because of what they've done online. So these are the ways that I think about preparing and how I sort of lead myself to do what we do here at UIC, the Department of Kinesiology and Nutrition.
Hi, John, it's Whitney.
Hi, Whitney.
And hi, students, I'm the other academic advisor. So my question, John, is In your research, so if I'm a clinician, so if I'm an athletic trainer or a physical therapist or a team physician, what ways can I take your research and use it to better serve my student athletes? How can I take what you've done and do a better job in treating my patient population?
That's a brilliant question. So let me tell you the ways that we think we know, okay? So sport by definition is short term because there's always the next competition, particularly in season. And so the first development I would say is personally for the medical professional. It's working on your degree of empathy and care. So that's the very first thing. So people care, so athletes care how much you care, often before they care how much you know. And so one of the things that we found out is that in the sports environment, it's very much the mindset is, what are you going to do for me now? And so athletic trainers are often caught in a hard situation between the coach and the requirements of performance. And the athletic trainer, what we found is that they emphasize the physical rehab, the acute care, and often they neglect the chronic care nature of this. And so where that's important, the first thing is to work on yourself and work on really appreciating and empathizing with somebody who's truly suffering, okay? And to try to do that day in, day out. So it doesn't mean necessarily commiserating, it means understanding and empathizing. That's the first thing. The second thing is informing and educating yourself on the emotional requirements of the athlete following the severe sport injury, so that you understand, as an athletic trainer or a physical therapist, what your role is. Your role is to give technical information that's correct, to reduce pain wherever possible, and to provide sufficient emotional support when you're with them. Now, those three things sound like they should be common sense, but what we found is common sense isn't common practice. And in fact, even the word common just doesn't seem to have much of a life. Yeah. So the second thing is to take a hold of yourself as a professional and fully grasp the requirements that you have in order to help somebody recover from a long-term injury. It's not the same as short-term. It requires much more emotional endurance from the athletic trainer as well. So you have to be equal to the challenge that chronic care provides you. The first point was empathy. The second one is the necessary informational, technical, and emotional qualities that you have as a professional when you're administering care. The third thing is to always, I can't stress it enough, always try to understand what the leading edge of the emotional difficulties are of the athletes. So what does that mean? It means that when you're with somebody, you're asking the right questions to elicit their mood. So you know where they're at the time, so you can calibrate yourself when you're delivering the care effectively. The last point is on confidentiality and trust. We know from our studies that there have been questionable ethical practices. There have been practices where athletes clearly feel that the athletic trainer and their medical staff has betrayed them. They've betrayed them emotionally and they've betrayed their confidence. And so I can't stress enough, in the context of our study, having an ethical compass is absolutely critical to the quality of the emotional recovery of the individual. If the individual believes and has evidence they can trust you, that you will not betray them emotionally because you empathize with them, you understand them, you deliver care in a proper professional manner, that you're always asking the right questions in good ways that are positive, and the information that they share with you remains confidential. I think these are the four things immediately that would lead to a much better set of relationships and much better emotional outcomes for the athlete, and a much more engaging and deeper professional relationship between the athletic trainer and the athlete. always the caveat is work into the scope of practice, Whitney. And I know for yourself, like as an athletic trainer qualified, you'll know this, is that when an athletic trainer identifies that an individual requires a mental health referral to a trusted provider, they need to have several things in place. Excuse me. First off is the understanding of what mental health referral is, how it operates, and then if it's in place, how to expedite that, and then how to coach the athlete to seek help. Because we know a couple of things as well, is that the athletic trainer, for the majority of athletes, the athletic trainer is the person that they most want to have a relationship with. The physical therapist is the person they most want to have an effective relationship with in their care. So the degree to which the athletic trainer and the physical therapist know how to do that, are competent in doing that and do it with care, often could go a really long way to coaching and modeling the help-seeking behaviors that we want athletes to take on for themselves to enhance their coping as they face the different adversities.
Thank you. That made a lot of sense. It kind of reminds me that building rapport, the genuine rapport, is really important, because sometimes, like you said, you get sidetracked and you want to reduce the inflammation, you want to increase range of motion, and you have to stop and think that you're treating a person, not an injury. So thank you.
Yeah, you're welcome. And as I mentioned, I mean, about the severity of the injury, when you read the research on emotional recovery with injury, one of the things that you notice in the research, and it's an overwhelming bias in the research, is the majority of research does not contend with injuries that are diagnosed lasting 6 months or longer. The majority of injury research is on injury less than 3 months. And you have to go very deep into the medical literature. Let's say, for example, with ACL tears for female soccer players at the college level, we know that there's literally thousands of studies on the physical aspect of recovery and the different types of surgeries and different types of return to play protocols. But when you look into the psychological literature about emotional recovery following knee trauma, what you find is essentially survey research, and you find very little that actually has to do with how specific medical roles are employed across time. So yeah, so I'm spot on with you. Like rapport is important. Like you said, genuine rapport is important. But what I find from this study anyway, Whitney, is that we're looking for individuals professionally that understand that their energy is going to be enduring, like the relationship is going to endure. We've interviewed people that sometimes are talking to us 15 years after their trauma, and they can name specific details of who helped them, how and why, and who didn't, how and why. And I think the relationship lingers way after the formality is ended. So, for example, a formal relationship might end for a student athlete when they graduate, but the memory of the relationship with that trusted, personal, competent athletic trainer lingers, sometimes we found, for years and years. And that's the legacy of a fantastic professional. What's one of the best experiences you've had working at UIC? That's a toughie, David, because I've had so many. First off, I love the study abroad programs. That's been brilliant. I don't know, my best experiences, I don't know. I mean, like, I just had one just before we came on. I was just talking with a student who's getting ready to do a 9-month research project with me. They just graduated and they want to spend 9 months with me and the rest of my team, like on a new part of this research project. I get jazzed up by working with people. I like working with like students that like taking risks. So my best experiences are working with people that like having a go, are ambitious, taking risks, I like people. I like having experiences whether I'm prepared for. I like surprises when they're positive, for sure. Yeah, study abroad. I've had some great courses, some brilliant students, and I'm lucky. Honestly, I'm lucky because I really like what we do. It's the best experiences. Definitely study abroad. Some of the courses with students has been just brilliant, absolutely fantastic. Got great colleagues. It's an easy place to be, David, if I'm honest. And so I won't lie to you. In 11 years, I've probably had, out of 11 years so far, I've probably had 30 cruddy days, probably like 30 days out of 11 years. But on the face of it, the best experience for me is showing up to work every day and doing what I do. That probably sounds a little silly to some, but I like what I do, and best experiences I've just had so many. It would be hard to put them out, but I suppose it would be study abroad, some of the courses, some of the great like one-offs that we've done. We used to do this research forum that Dr. Hamstrom Wright would lead, and we used to have up to 500 people there, and undergraduates would like produce their work, and that was awesome. Yeah, we've just had some great moments, so hopefully that helps a little bit. So you mentioned that you identify with this personally because it's what you prefer when being treated. Is that something you learned through your research, or is it something you've learned through experience in your time as an athlete? Thank you very much for that question. So I learned once I was injured as an international player, and I was dropped from the squad. I never made it back, and despite some effort, was never considered again or even spoken to again. So first off, I noticed as a player, you're only valuable when you're performing in certain contexts, and certainly when you're at the professional level, all that matters is the game that you're playing and the game that you're fit enough to play in, which is the next one. So understanding that was a harsh lesson, particularly as I was 25 at the time. So I'd had injury setbacks before that, but when I had the big one, the career-ending injury at the top level, that was instructional. I was able to get back, but I was able to get back to play at the amateur level in a world championship. But of course, there's a difference between amateur and pro. Yeah. So that taught me. But then when I was coaching, I was really lucky because I finished, although my degree is in business, it's business, sport, and recreational management. And so I was really lucky that 50% of my undergraduate was spent coaching, learning how to coach. And we spent, it's different when I was coming up in England, we would spend 9 months on a single subject versus, 30 hours in class, let's say at college. So you spend 90 hours, like 9 months on something so you could get really deep into it. And I had some amazing professors, and I was able to learn because we also had to do like internships for sports coaching. We had to get national awards and so on. And it essentially being trained to be professional coaches, which is eventually what I became at another point in my life. And you learn as a coach what's ethical, what's the right way to go. And so I was lucky that I came up through a program that stressed ethical treatment of players and athletes. And there was an emphasis on demonstrating and role modeling those behaviors. It's not to say that you don't make mistakes, but you're aware of a mistake when you make it. And so the sport part, the coaching part, and then when I started working clinically in 2001, from 2001 until 2018, working with athletes in clinical situations, and then just facing these challenges and sort of like head on, that's what taught me. And of course, becoming a psychologist and becoming a counselor as I am, what it did was to add science and good clinical training to what was already in me previously. I think it's very important, when the body and the mind lasts longer than our athletic careers. Most athletic careers in the United States end for most people when they leave high school. And for those that don't, they might play on until they're like 30. A veteran these days in pro sports is like 30, 32. You know, when I was coming up, and a veteran would be in their mid to late 30s. So sport careers are much shorter. They're far more intense. The requirements of sport are incredible these days. I mean, whether it's women's sports or men's sports, those athletes or dancers, you know, when you look at ballet or contemporary dance, you look at what dancers put themselves through to perform with incredible grace, composure, and poise, and at the same time amazing power and flexibility. It's really something to behold. Your life goes on longer than your athletic life, and so I think these days for me, it's very important to look at the person in the context of their entire life first, and then their sport, and recognize that there's an interaction. It's not one or the other, that they interact together.
Thank you for joining us today. Thank you to everybody that joined us today. We hope that we got you excited about your kinesiology classes in the fall. All summer long. So join next week for taking the classroom to the our instructors' lounge. And don't forget, if you haven't already, there's still time to submit your intent to enroll to let us know you're coming to UIC in the fall. Orientation's going to open up on June 1st, and once you've completed orientation, you'll get more information from Whitney and I on how to register for your fall classes. So thank you again, everybody, for attending. We look forward to seeing you on campus.
Thank you, Joe. Thank you, Whitney. And thank you to everybody for coming today and being part of this. We hope to have you at UIC. Go Flames!
Very nice, very nice.
Thank you very much for having me.